Now let's turn our attention to medical matters, and one of the big talking points out there at the moment is Ozempic. People are talking about it, people are hearing about it. What is it? Who better to talk to us about it now is Leonie Grant from Grant's Pharmacy. Good morning to you, Leonie.
Good morning, Alan. How are you?
So what is Ozempic?
Do you know, Ozempic as a class of drug it's kind of mimics a hormone that is naturally occurring in our own bodies. So it's in the class of drugs called glucagon-like peptide 1. So it's a mirror image of something we all have in our bodies. So therefore it's quite nice to ingest and use a drug that's very similar to what we have in our bodies, because then the side effects and the rejection and all that will be quite low. So it won't be that toxic, you know. But essentially, this is a drug that has been used traditionally for diabetes type 2. So that's the non-insulin dependent one. And what it was found to do was it would regulate the blood sugar levels, and almost as a side effect it was causing weight loss, which is quite good, because a lot of people who suffer from diabetes, especially type 2, sometimes diabetes type 2 is brought on by overweight and obesity. So this drug was very nice because it regulated the blood sugar level, which was the whole point of it. Can be used with other diabetic drugs, and as a consequence as well, some of these patients lost weight. So therefore they looked at the drug again and said, okay, how can we use this drug? It's called semaglutide. How can we use this drug in another way, to use it for people who are struggling with their weight? And they found that if you up the dose a bit, it can be, they licensed it as the brand name Wegovy, and it's used for obesity and for those people who are overweight. And it can drop someone's weight by up to 20%, which, you know, is when it came out first, it was kind of heralded as a game changer.
How is it doing this?
So not only does it regulate the blood sugar levels, it also interrupts the gastric emptying. What that means is your stomach empties. When food goes into it, your stomach gets rid of the food out of it. And as the food empties out of your tummy, you get more hungry again. It delays that process. So therefore, you think you're fuller for longer. Also, it does work in the brain, in the satiety centre. That means your brain tells you, I'm eating this much food, I'm now full. And what they found in people who are struggling with weight, who are obese, some of those processes are dysregulated or don't work properly. So that some people don't know when they're full, or they keep on eating, or you know, that they feel they've eaten now and in another half an hour they're ravenous again. So this particular drug tells the body it's full, tells the body to slow down in emptying the stomach, and not only works in the gut, in the GIT, in the gastrointestinal tract, it does work in the brain as well. So there are links that they've looked at loads of different uses for this drug, and they've looked at it in addictions, for mental health issues. It's also having it's just been out in the media recently, that's why I probably wanted to chat today about it, that it has a huge beneficial impact in kidney disease and in cardiovascular outcomes. So
does it have to be prescribed?
Oh yeah. At the minute, Ozempic itself is used for diabetes, and if Ozempic at the dose that Ozempic is used at is given to people, for example, for weight loss, or now going forward maybe for kidney conditions or cardiovascular health, then that will be used off-label at the minute, or as an unlicensed use. So that's a decision for the healthcare professional to take.
But you can't go in, people listening to us, and I'm very conscious of and the fact that I'm talking to a trusted medical practitioner like you, Leonie, because I would not be having this conversation with anyone unless they were qualified to talk about it, because the last thing I can afford to do is to give people false hope. And I would be very, very wrong of me to even attempt to do that. So having you, I trust you implicitly in studio to give us an overview of this. What are your own thoughts on it as a matter of interest?
You see, what's happening, I suppose, there is a black market in it, and like Ozempic has nearly been all over the internet and social media with, you know, high profile stars losing weight and saying this is as a consequence of using this drug. Therefore, the people who are using it for medical reasons, for diabetes and for obesity, can't actually get their hands on the supply. So in Ireland, we're really, really strict about prescription use. It has to be prescribed properly. And even still, Alan, the supplies across, not only in Ireland but across the world, are very challenging.
But you cannot get this unless it's prescribed for you. Is that
no,
what
you
you're
can't.
saying?
But
people are trying to buy it on the black market. Is that what you're saying?
Yeah, exactly. Yeah. And it is.
How dangerous would it be if you bought it, Leonie, and then you started using it without getting medical advice? How dangerous would it be for you?
Well, it's like any drug that you take without being monitored. You know, there are side effects to all these drugs, and all those side effects must be monitored. And I suppose with any drug, if you're taking it on your own without any help or without any healthcare provider looking after you, there are dangers. There's dose dangers. There's also the danger that what you're buying in the black market is not actually what you're getting. So it can be, you know, adulterated with something else or combined with something else. So you get a vial or you get a pen, an injectable pen, and you don't actually know what's in it. Whereas in pharmacy in Ireland, we go through all the rigorous testing of, we've a falsified medicines, which we have to all scan our medicines from the manufacturing floor straight through to the pharmacy to make sure that they're all exactly what they are, you know, and we track it from the manufacturing floor straight through to the
So let's
patient.
look at it from the legal side of things then. There's somebody listening to us at the moment and they tick the boxes that you've referred to there. They want to seek advice as to whether this could help them and give them a better quality of life if they were to shed some weight. And sometimes shedding weight doesn't always give you a better quality of life. What would your advice be to somebody listening to us this morning who feels that this could be for them?
Yes. So if we had all the supplies in the world, I would be saying to people they need to have these conversations with their doctors and healthcare providers.
Yeah.
At the minute, I think GPs are a little bit. It's difficult to prescribe these fellas, and there's a few of them on the market at the minute. There's another one called Trulicity. And it's in conjunction with their other risk factors. So certainly we're looking at risk factors for a person. So if you're using it for diabetes, it seems to have really good results. There are side effects. You can get GI, like nausea and a bit of constipation or diarrhea. You can have a bit of fatigue and malaise at the start. That usually lessens with time. It's a once a week dosage for the Ozempic. There is another one that is used for weight loss and obesity. It's called Saxenda, and that's a daily injection. So it's about, I suppose, you know, choosing the right medication in combination with the other risk factors for the person who's in front of you. But certainly it is I think fast forward another couple of years and there's going to be a huge amount of people on these drugs.
Obesity.
Yes.
You have it on your list of things you'd like to talk about. Is it a side effect that, it's a reduction of obesity, isn't it?
So, yeah, at the minute, Alan, over 50% of people in the EU are overweight. That's a massive statistic.
How many? What percent?
50%.
Wow.
So what's going on, you know? And there's so many strands to the overweight and obesity epidemic that's happening at the minute, and it's probably more a public health issue. These drugs, however, decrease the weight by a certain percentage for people, thereby in allowing healthcare providers to offer something to people when they come in and they're really struggling. It is not a solution to obesity. These drugs are not the solution. They're part of the solution. Right. They can bring someone's weight down so that then they have maybe the motivation to eat a healthier diet and to, you know, get moving and feel a little bit better about themselves. Thing about these drugs as well, they're probably a lifelong option if they're going to work. So they'll take off that weight. A recent study after 3.5 years following about 17,000 people on these drugs found that the weight stays off for 6 to 12 months, which is brilliant. So if you stop this drug tomorrow, you're not going to put back on the weight in the next week or two, but gradually it'll creep back on again. So it is part of the solution for overweight and obesity, and it can not only help with stroke, heart attack. It decreased heart attack in some of the patients by 30%. So your risk factor was decreased by 30%.
Right.
That's enormous. And that was outside of the weight loss factor. So add into that weight loss, which will bring down your risk factors for all those cardiovascular events, kidney diseases, cancers, and diabetes risk. All of those will be decreased anyway with a bit of weight loss. And these drugs also help in those conditions. They're not 100% sure how they're doing that. But because of all of those things, they are being heralded as game changers.
Fair enough. We leave it there for the moment. We put it out to our Morning Mix listeners. What do you make of what you've heard from Leonie Grant? I know you want to make a quick comment and maybe look at it in more detail when you're here, but time is catching up on us, Leonie. But you do want to talk about the free contraception scheme. What would you like to say about that in the short time frame?
It's really just to make young women aware of it that may not be aware of it. So it is free for women aged 17 to 31 to see their GPs, get a prescription and bring it into the pharmacy. They get the contraception of their choice, whether it's the oral pill, it's a patch, it's the coil, it's an injection, all of that free.
Right.
Free, zero to pay. So it's a really good scheme. I'm not sure that everybody in the country knows about it, so it's just to really highlight it. And then also, if you need emergency contraception, so traditionally known as the morning after pill, if you need that, again, and if you're in that age group, pop into the pharmacy. Don't need to see the doctor, into the pharmacy. If it's appropriate, it is free.
Thank you for talking to us this morning, Leonie.